Hello everybody, Aaron and Jason here from
Hello.
MMT. Going to show you a classic MMT Moneyspot treatment, alright? Get Jace ready for his weekend.
Hey.
Whatever he wants to get up to. Bit of footy, Jace.
Bit of footy tomorrow, yeah.
Yeah, let's get you ready, alright? So just going to sink into our classic lower back erector Moneyspot. But I'm not going to go too deep to start with. I'm going to stay quite superficial. Just sink into these erectors and let them receive the treatment. And I'm just slowly going to start to trace around that ilium and out. Like, I know Jason's body pretty well now. He's got one of the biggest erector complexes going around.
They can be pretty flicky. And,
yeah, they're a bit ropey. So I know that, yeah, sometimes you've just got to kind of unwind a bit of superficial tension on Jace first. Otherwise, you can go flying off these erectors and it's a bit, it's just a bit unsatisfactory for the receiver. But it also can agitate tissues and maybe make them a bit more, not inflamed, but just make them a bit more tender. So when you're doing your treatment throughout the hour or however long you've got with your customer, it might just be a bit too painful to go through. So it's all part of that tactful service that we do as bodyworkers and MMT bodyworkers. You know, we're working slow, we're working thoroughly, but we're trying to do it in a tactful way that doesn't damage tissue, doesn't cause more trauma. It tactfully releases it without causing extra bruising or things like that, you know. So
there's a bit coming up out there.
I'm just slowly tracing around the went off that erector complex. So kind of went into, for all you anatomy nerds out there, kind of went over longissimus and iliocostalis, and then kind of sunk into the QL, and then just this oblique space here. So I love doing these warm-up strokes.
Oh, feels so good.
Feels nice, doesn't it? So we'll do another one here where we use the breath there on Jace, just sink in. And the pressure's kind of going downwards towards his ilium, but then also out and around. Just trying to imagine you're like taking pressure away from the spine. So I start next to the spine on the erectors, but my pressure is going kind of downwards and around. So we're taking the pressure and all those layers away from the spine. So if you think about something that, like the lower back, when it's stuck in a lordotic curve, not stuck, but excessive lordosis, you know, compression, extension of these lower back joints, if we can peel things going laterally, both sides, it's going to allow that kind of C curve to maybe lessen and, kind of things to open up and expand. So, you see me slowly coming out of that. There, that's it.
There's a good spot. Oh, bit of spice.
Bit of spice in there. Jace, how would you articulate what you're feeling on the receiving end?
On the receiving end, yeah, it feels really therapeutic to me. Like, it's only as you get out, sort of probably that QL, as you're angling back under a little bit, it's where I feel a little bit of, pain in there. But it feels like it's a good sensation, like those erectors have been tight and need that work done.
Yeah, so we can see redness there, so blood flow. Seen a decrease in tone on that side already compared to that side. So yeah, you can make some changes pretty quickly in this game if you're, I guess, aware, you know. Like I always say when I'm teaching that obviously subjective change is massively important, the person saying, I feel better, but I love to look objectively as well. Like, what does the tissue look like? How's the movement look like? Have we restored strength? Actual markers that can indicate a change, as well as a person saying they feel better. So as a body worker, look for both, I think.
Because people can always be a bit negative wired as well. Like, they still might feel a bit of pain. So they're like, oh, it's still sore, but it's not the level they came in with, or their movement might be a hell of a lot better. Or, for instance, just for example, they might be able to go down, touch the toes, or go halfway down to their shin, where before they could only get to their knees. So that's something you can actually tell them about. Like, look, you're getting a lot further. Yes, you might still be a bit uncomfortable, but yeah, you can see the progress. You've
got to have your markers, don't you?
That's right.
Your KPIs. And I think it can go the other way too. Someone can kind of blow smoke up. You're saying, yeah, I feel better, you know, because I don't want to hurt your feelings or I don't want to have confrontation. But that's not getting anywhere, is it?
No, that's right.
You need honesty, and that's why you need both.
Yeah. Honesty from both parties is the way to get it done. Yeah.
That's it.
If one's kidding themselves, it doesn't help the journey.
No. It's about to sink off that again.
Oh, there's a bit coming up.
Nice wide stance here.
Oh.
There's some good stuff in there, Jace. Work with your breath, man. Nice work. Well done. Well done. So we'll finish that stroke and then we'll come around and have a look at some of the glute. Because they go hand in hand. If we have tension through here, the glute med, glute min can tug on that area up here. So, sorry Leo, I'll just come in front of the camera here. So Jason, I know, once again, I know his body, quite hypertonic, quite painful in this area. So we go slow, pick our landing spot, and then we just ease into these tissues here. Get my kind of wide base of support, figure out which one I'm going to flick up under and drive up under, and then push into that there. How you going there,
That's not too bad. I feel like more like glute med is probably where my tender spots are going to be. That one feels just nice, therapeutic,
so
good,
we'll start
deep
there.
pressure.
Just got to be patient sometimes too. I say to students all the time is, you don't want to start moving too quickly. Sometimes you just got to have the poise to keep your elbow there and let the tissue change, let the person familiarise themselves with it, let a little bit of perspiration come out onto the skin, a bit of heat underneath the skin, and then the pathway where you want to take the stroke will show itself. Sometimes if you try and manufacture things or you're working too quickly, the experience is not good for the person on the table. Whereas if you wait there and it's painful at the start, after 10 seconds, 20 seconds, a bit of breathing, that whole complexity will change. Sometimes it starts quite sharp and acute, but then it becomes deeper and a more therapeutic release. So sometimes just having the poise there to push through something, a bit of short-term pain, you're going to get a lot of goodness on the other side.
Yeah, absolutely. And a lot of the results that we say we've had, like it's when you don't move at all. Like sometimes just holding one spot and you're doing little micro moves or wiggles or something, but you're not actually moving on the tissue. That's sometimes when you get the best results. So don't feel like you need to always flush through the muscle and move on.
Yeah, spot on. When we're dealing with chronic pain, a lot of things that have been embedded in the body for a long time, we're not really moving at all. We're just pinning, holding these spots and letting them melt and changing the tissue that way.
And that, as Aaron said, as the receiver, like from my experience here, like that feels so good. Just, like it was pretty sharp at the start, but the fact that he just stayed there and waited, like it got to the point where it just felt like a deep pressure, but there wasn't that sharp, acute pain where if he had started moving straight away, I probably would have still been fighting him a little bit. So there's a bit uncomfortable.
There's a bit more, so we'll hold that and see if that changes for Jace. So you feel like I'm just more under that tendon or something? Yeah.
And it's pretty sharp there at the moment, but I feel like it's already starting to dissipate, where if Aaron starts moving already now, then it's probably going to hit a new spot and might still hold on to that.
Starting to change there.
Yeah, it is. Yeah.
So what we can do now, I'll just wait there a little bit more, and then I'm just going to grab the leg and start to do a little bit of passive stuff, see if we can get just a little bit of movement and range of motion in that hip. So I'm just going to hold there first. Just let him get familiar with me holding his leg, still keeping the pressure on here. Some people like to start moving the leg straight away, and it's just got to let the person relax. So I'm just going to pin there, not put on any more pressure, and then just start to open that hip up. It's good. And then move it back in. And then open.
Yeah, there feels a little bit as you get out that way. Oh,
move back in. Good.
That way feels all right.
And open.
Oh.
And move back in. Very nice.
Oh,
beautiful there. Let's come back and do one more stroke through here to see if we've got any change there. I'm just going to go quite light, superficial. So remember, when you're a massage therapist, you've got to think about your intention, like at what level of structure are you working into? So for me here, I just want to work into that superficial thoracolumbar fascia, maybe a bit of the erectors, obviously the lat as well as it comes into that thoracolumbar fascia there. Like I'm not really looking at QL for this one, so I'm not going too deep. I'm just keeping superficial and starting my stroke a little bit quicker because I just want to do, that more surface level release rather than going too deep. So as I come out here, I know that as I come off the edge of that, we're going to hit Jason's part where
there's a little bit.
It's quite sore, but doesn't feel too bad there. Beautiful.
Oh, so good.
So what we're going to do now is just have a look up in the scapula too, because all these erectors do come up somewhere and attach into the rib. So we're just going to work into our classic scapular point here, okay? So once again, this can be quite brutal on a lot of people. So let's just find our starting position. Let Jason get familiar with what we're doing here.
Oh, yeah.
Yeah, it's pretty brutal. So I'm just going to rest there. Just rest.
A couple of flicks.
And see how he goes. There's nothing too audible coming out of Jason to
No,
start
that's all right.
So
I feel like
that's
it's
pretty
not
good.
far away, though.
yeah, I'm just going to wait there, though. Doing good, Jace. A little bit in there, man.
A little bit in there, yeah. Yeah, I feel like down's going to have a bit more in it, too.
Yeah, I just don't want to move until I feel confident that you've let me in, which I can slowly feel like the path is opening up for me. So you can see my elbow there. It's kind of rested up against the top angle of that scapula. And yeah, so we're releasing some rhomboid, some trap. And sometimes just sitting here can be really, really good. You don't have to move. You just sit to that point, melt those structures in between the shoulder blade, and that can do wonders for
so many things.
a shoulder, a neck, yeah, headaches. But yeah, like for me, underneath my elbow, the feeling and the sensation has changed so much to when I started. Like at the start, it felt like I was nowhere near bone level or tendon level. I was just sitting on top of these really strong muscles that Jason has here, heaps of tone in them. But now, yeah, I can really feel the edge of that scapula.
Feels like you've sunk in a lot further.
Yes.
On my end.
I can feel the ribs, like I can feel so many, so much of Jason's skeleton. So now I'm just going to start to see if I can trace and just see what happens for Jace. So me looking like you got to have X-ray vision as a bodyworker. So that crease line there, that's Jason's scap. So that's kind of where I want to be snug up against. And I'm just going to start to move.
There's a bit there.
There's something coming up. Oh, that was good. I feel like I flicked over.
But in a nice way.
Yeah, I flicked
just sort
over
of rolled
something
over.
tactfully.
Yeah.
Now I feel like I've got this kind of leverage point where I can
Hook in.
hook in. Still feels pretty
Yeah,
therapeutic.
it still
though
feels
there,
good,
Jace,
yeah.
Not too brutal.
Nah. The pace of it is another key. Like, it's just the slowness. We can't iterate it enough.
Yeah.
The slowness is what allows someone to relax. If you're flying through there, it's so hard to let go because you feel like it's going to cause more trauma or it's going to be painful. So you are fighting them.
Yeah.
Where because it's slow, I can feel that Aaron's not going to flick over. Or if he does, it's only going to be that therapeutic sensation of a flick where, yeah, when someone's flying through there, you get a bit nervous sometimes.
Yeah, exactly. I feel like I hit the end of a road
Yeah.
there, so I'm going to come out and just let that go. And then what I'll do now is just a bit of a broader stroke. So I could have started with a broad stroke, but I'm going to finish with one now. So using my pisiform, heel of the palm. Remember, this time I want to do more of a stroke, so I'm not going to go as deep. I'm just going to think about going into the trap fibers, maybe not as much rhomboid or any of those erector muscles, the kind of paraspinals underneath. So I'm staying lighter, and already I can feel like I'm moving. So I can feel the edge of the scap with my pisiform and just tracing all the way along here. And there is normally a bit of a nugget coming up here.
Yeah, a little bit.
What I can do too, another good tip as a body worker, reinforce with my other hand, and that'll help me get more pressure on. I feel like there's something coming up right in here, yeah.
And some people would question, like, why didn't you start with this, Aaron? But as you said, like, when you start to know, say, a client's body that you might have treated a few times, you can tell if you can start with a deeper pressure or start with that more with an elbow. Like,
exactly. Yeah, it's kind of an intuitive thing, isn't it? You kind of...
like, yeah, someone did their first session, you're not going to start with an elbow in there. But once you start to know someone's body and how much they can, or what they can tolerate, you can start to still be broad with the elbow, but you can use that to your advantage a lot more.
So let's get into some hamstrings here, okay, just to
this will
see
be
what's going on. I'm just going to do one side of the body for Jason today, but I'll make sure I even him up off camera. But for the sake of the video, we'll just show one. So with our hamstring warm up, got our gluteal fold there. Just going to do a palm stroke. So pick up the slack, and remember this is just a warm up stroke to start with. So just quite superficial, quite broad. Just warm up that fascia, warm up that skin, get an idea of if there's any kind of lines that are potentially going to yield some good stuff for us. In Jace, I just felt like I was getting a bit too hair pulley on that one, so I just reloaded and put a bit more wax there. Yeah, if your person, just got to talk to your person. Is that pulling your hair? Do you want me to put more wax on? All these things just make the treatment more pleasant. See, right now, I don't think that's pulling hair.
No,
is it,
that's
Jace?
good. No.
So you can do these lines of warm-up strokes just going straight down. Grab the other side of the table if you want to get a bit more pressure on. But yeah, I feel like Jason's bicep femoris, which is the lateral hamstring line, had a little bit of curry in it there. So see if he feels the same thing here when I come down over that line there.
Not too bad there, actually.
Not too bad.
I feel like high medial, but yeah.
Yeah, so what we're going to do now is work on the where Jason said.
Yeah, in there. Feels.
He's got a bit of curry.
Yeah.
So I'll just push into that. I won't go down this time. What I've been doing lately is just working some cross fiber stuff. I feel like sometimes these upper hamstring muscles can all get kind of stuck in the same pocket or kind of fused together. So I don't mind doing these, cross fiber strokes where you roll over, staying quite superficial, but just going over sideways. It kind of can feel pretty good, can't it, Jace?
Yeah.
There's just a few lines. Like there's, the hamstrings are a big muscle, and Jason works them out a lot. And with sprinting, footy, the way we deadlift too really requires a lot of adductor magnus, which is like and it's an adductor, but we call it the fourth hamstring. You might have heard us refer to that before. So I feel like, as soon as I put my palm in that adductor magnus position, Jace just goes through the roof. So potentially if we take a bit of tone or symptom out of that, it might make Jason's performance feel better. Just maybe walking around, that pelvis might feel a little bit more unlocked.
So much in there.
So much,
it's
isn't
good.
it, Jace?
Yeah, it's good though.
Doesn't need much. Like this is very much warm-up pressure. It might look like I'm getting a bit of leverage here, but I'm not pushing too hard. And this is another thing too. You might have someone with a nagging lower back, and it could be the fact that these adductors are really sticky and it's tugging on that sit bone, which is giving them the discomfort up here. So that's where as a bodyworker, you've got to be inquisitive. You've got to explore. You've got to leave no stone unturned because the answer's always there. For our history as bodyworkers, like sometimes when you think you can't find the answer for this person and you find it in the most random spot and it creates that change. That's what gives you that knowing that the answer's always there. And most of the time it's easy to find, but sometimes you need to look a little bit harder. And but those wins are what makes you realise that the answer's there. We can find it, So never stop exploring. Keep studying the body. Study postures. Study movement. Pay attention to the tone of structures. Good person that I study a lot is a guy over in Ireland, and he says give them what they don't have sometimes. Like have a look where their movement's breaking down, or it's an amazing job. It's a challenging job, but it is amazing when you can get a result for someone when no one else has, and that's what we kind of pride ourselves on, Jace?
Yeah, that's right. Oh.
I think Jace definitely needed this for sure. Because he's got footy tomorrow. I'm not going too hard, but you can tell in there, Jace.
Even just that, dude, just picking up the slack almost. And it's
I could just hold that, couldn't I? And it's pretty much just like a heavy stroke. Good breathing, man. And once I get through that, is that...
Yeah, now it feels all right. And then you hit a little bit sort of as you get out to the lateral side as well.
Yeah, if you have a look, Leo, when I go over that bicep femoris line, you'll be able to see a little...
There.
See that? A few little flickers there.
Oh, there.
There. That's pretty cool. All right, Jace.
Deluxe service today.
Deluxe indeed, man.
Good.
Let's hook in here and we'll do a stroke going downwards. So once again, just resting the elbow there. Allow Jason to receive that pressure. It's feeling okay, man?
Yeah, that's feeling good.
All right. Do you feel like you want me to stay there or take that
I reckon
downwards?
you can start to move. Yeah. It's not as tender as even some of the first warm-up strokes were,
cool.
so...
Took some stuff out. So I'm slowly starting to travel down. But remember, not forcing it. I feel like I'm forcing it a little bit there, so I've just kind of got to back off. Allow that tissue to let me through. Don't force, don't rush. How's it going there, Jace?
Yeah, that's fine. It just feels like nice pressure, but nothing too intense yet.
Nothing too intense, good. I feel like I've just kind of entered a different little gutter there.
How do you explain the difference between, like, waiting for the tissue to let you move and not pushing through, Aaron? How would you, for someone that might be unsure of what that means, how does that work?
I think it's friction. Like when the slack of my elbow and the slack of your skin are both taken up well, there's a nice stretching feeling under my elbow and I'm kind of carving through the skin without even pushing.
Yeah.
It's like I'm not even trying to move and I'm moving.
Yeah.
Whereas when you hit a snag, you can feel yourself like trying to push
through it
and barge into something. It's like, you know, when you're trying to turn a key and it's the wrong key in a slot, you know, it's not working. So like now I just feel like your body's letting me, traverse through these lines without having to force. Like I'm not even trying to move and I'm just going.
Yeah, it's like you're not exerting your body to move through. It's just like my body's almost letting you go through.
Yeah.
So.
Yeah, it's awesome. So we'll just finish off with a bit of a calf money spot for Jace just to get him prepared for tomorrow. Let's see, just feel into the calf, a bit of palpation. Where does he need it? I kind of feel like just in here potentially could be a bit of a gem.
Not too bad for a calf, yeah.
So I might do some spot little treatments here. So.
Oh, thanks, Leo.
It's not too bad.
No, not too bad.
We'll go to our classic ankle money spot up here.
Oh, that's got a bit more on it.
That's got a bit more. So sink there, wait. Give that 10 seconds. Big deep breath, Jace. And let it all go, man. We'll go one more. Is he borderline cramping, isn't he?
There it is. We got there with a cramp.
Let's just finish him off there. I'll just do some light stuff so he doesn't cramp there. He loves the cramp in his calf, doesn't he?
It's that medial line, I reckon. It always...
Well, that's why I started there, because it felt like you needed it there more so, but... Is he going again?
No, that's not too...
Alrighty. We'll give him a little foot boogie to finish, eh? Just because... Best. So just boogieing the feet a little bit here. So one of our classic movements is to just, block an area and move it. Twist the foot a little bit. Loves this kind of stuff. Spreading all these areas that have been compressed. Well, Jace doesn't really wear shoes either, but footy boots would give him a little bit of curry. Yeah. But yeah, it feels amazing, this stuff. And the heel. I think the heels love to move. So yeah, that's really good in there.
Oh.
All right, Jace.
Thank you.
There it is.
That's the best.
Little spot treatment for Jace before footy. Hopefully you guys learned a few nuggets there in terms of some strategies that bodyworkers like us use a lot. But yeah, hope you enjoyed it. Make sure you like and subscribe. Heaps more content coming at you. We'll see you around.
Thanks, guys. Thanks, Az.
Thanks, mate.